Hello, this is Mark Garrett here, co-owner at National Senior Savings and your host at the podcast, The Medicare Minute, which can be found on iTunes or Google Play Music. This is Medicare Learning Modules, module number 7. When can you enroll in a Medicare supplement? So Medicare supplements are pretty straightforward and pretty easy. The first time you can enroll in is during your open enrollment. The 6 months beginning your birth month of turning 65, following that month, you have 6 months that you can actually enroll in a plan. You actually can enroll in it before you turn 65 and your Medicare starts too, but the plan won't be effective until that date. You can also enroll in it 8 months after you leave your employee group coverage if you were past 65 years of age. So if you work until you're 68, retire, you have 8 months after you leave that employee group coverage to sign in and join a Medicare supplement plan. So there's the annual enrollment period. And this really only applies to people that are on Medicare Advantage. So between October 15th and December 7th of each calendar year, you can leave a Medicare Advantage plan and sign up for a Medigap plan with a RX prescription drug plan to go along with it. Just keep in mind that past the age of 65, when open enrollment, you're guaranteed to be accepted into a Medicare supplement plan. It will be medically underwritten, and you have to answer a series of questions, and depending on the company and what their standards are, you may or may not be approved for a Medicare supplement plan. The other time that you can take and enroll is a special enrollment period. That's if you move out of the area of the Medicare Advantage plan. You move once again from, say, North Carolina to Kansas, and you've moved out of your area and it's time to start fresh. You will actually have an opportunity to sign up for a Medicare supplement plan. If your Medicare Advantage plan stops offering the plan that you were on where you live, you may enroll in a Medicare supplement plan, and that does happen. I've had quite a few clients that were on Medicare Advantage plans, and for whatever reason, the company didn't offer them that year, and they had to disenroll. If you join a Medicare Advantage plan for the first time and you aren't happy with the plan, you have special rights to buy a Medigap policy if you return to original Medicare within 12 months of joining that Medicare Advantage plan. If you have had a Medigap policy before you join, you may be able to get the same policy back if the company still sells it. If it isn't available, you can buy another Medigap policy. If you joined a Medicare Advantage plan when you were first eligible for Medicare, you can choose from any Medigap policy within the first year of joining. The Medigap policy can no longer have prescription drug coverage, even if you had it on a previous plan, but you may be able to join a Medicare prescription drug plan. Of course you will. You'll be able to join that plan without any questions whatsoever. So the next topic is plan to plan changes, and that's something that we do a lot of and we specialize in as we help people go from Medigap plan to Medigap plan when they can be medically underwritten and they can save a lot of money and get into a plan that frankly fits their needs more. You can change from a Medigap plan to another Medigap plan whenever you would like to. It does not matter if you change companies or plan letters. That plays nothing into it. They don't care. The federal government regulates that all plans have to be the same. So if you're changing to a plan because it has a cheaper plan than the one you're on currently, and it's the same letter plan, that's fine. And if you want to go to a different letter plan than the one you're currently on, that's fine also. Keep in mind, past 65, it will be medically underwritten. Some states make companies give a guaranteed issue no matter what their health is on the enrollee's birth month. So you just have to be aware if you're in one of those states that allows you to make a change without any questions whatsoever. As long as you are staying with a Medigap plan, you are not limited on how often you can make changes. And if you are in a Medicare Advantage plan, you will have to wait until AEP. Those are the two most important parts of Medicare supplements and when you can enroll. If you are in a Medigap plan, you can make changes as often as you like to. And if you are in a Medicare Advantage plan, other than being in the first year of that Medicare Advantage plan, you will have to be medically underwritten. So keep those things in mind. Once again, my name is Mark Garrett. I'm the co-owner at National Senior Savings. We host the podcast, The Medicare Minute, on iTunes and on Google Play Music. You can reach us by dialing 800-708-5810. Thank you very much, and you have a blessed day.